here I have found a very beautiful quote, like act like a doctor, think like a patient. Like it's very difficult. Like it's written in proverb is very easy, but when you go to actual practice, it is very difficult to understand. What do a patient from want us? They want thorough physical examination. They want clear diagnosis from you, not only from you, any healthcare practitioner. You, if patient goes, they want physical examination properly, and they want diagnosis what actually wrong with them, and your job is to educate their problem, whether it is acute or chronic. You will find out the cause and you will educate the patient. That's your job. Then definitely patient wants personalized and individualized care. When you have the data with you, history, all the factors, then you will be able to plan better plan of care for the patient. And finally is the prognosis and plan of care. So these are the basic outcomes patient want from us. So the patient assessment for PNE, as you know, the pain neuroscience education, before delivering, you should know the outcomes, right? How to assess the pain related knowledge. First, you need to find out your patient education level related to pain, not exactly related to medical terms, but in general terms, pain related knowledge, which you can use neurophysiology or pain questionnaires. These are the one outcome scale which you can use for find out the pain belief. You can use the pain catastrophizing scale, survey of pain attitude, then central inventory, which is very commonly used for the central pain or chronic pain patients. Psychosocial factors which can be identified, the Tempa scale of kinesophobia, pain self-efficacy questionnaire. These are all questionnaire which you can use before and after treatment, which will give the positive impact on patient along with the exercises, right? So you need to find out the red flags and yellow flags, right? Early detection of yellow flags allow for targeted PNE intervention, whether patient needs a psychological intervention, cognitive behavior therapy with the psychologist. So you need to find out the multidisciplinary approach, but before that, you should know the what is exactly the problem in your patient. It is like catastrophic thinking or fear avoidance behavior or passive coping strategy or low self-efficacy or poor social support, which we need to find out, right? Through these outcomes. So as you know, all this is a multimodal approach, biopsychosocial approach. This model is mainly the underscore the integration of biological, psychological, and social influences of the health. So in case of the chronic pain, a narrow focus on structural issue like muscle, joint, often overlooked clinical contribution. So you need to find out some factors such like sleep quality, emotional status of the patient, cognitive belief of the patient, social support, how much patient has a social support system can be addressed to fully understand and manage patient pain experience in chronic pain patient, right? So education is very difficult, right? Each patient take a different path for the education. You must have seen the when you are delivering lecture to the students, every students take that concept in different level. All the students are not similar stage, right? Some are slow learners, some are fast learner. You need to find out same way in your patient. Whatever you are throwing to your patient is not grabbing 100%. Some patient may accept 50%, some patient may accept 20%. So you need to find out your patient education for different path for different patient. So education is very difficult, or it's challenging for the patient when you're educating the patient. So here are main core theme behind the PNE, where you need to find out the pain is not equal to damage. Pain is produced by the brain, which we already have seen the scenario and the experiment, by the brain, not the tissue. Explain the pain is a protective output from the brain, not always the link to the tissue injury. Example, pain is like a overprotective alarm system, as you told, as we discussed in early. Then second is a neuroplasticity. The nervous system can be retrained. Just as we learn the bad habits, we can also learn the good one, and your brain can unlearn the pain. That is important. Then context is always matter. The belief, the thought, the stress, and environment can influence your pain perception. Multiple factors influence the pain processing. So these are the core theme in the PNE while delivering to target your patient, right? So how to deliver the PNE? There are different modes or methods like educational tools. You can use a prepared pictures, metaphors in the analogy of patient own language, where the patient can understand their problem. hand drawing or any written material which patient can understand easily. Format can be one-to-one session. You can take the group session for the patient. You can give the tele rehab. So these are the different delivery methods of the PNE. These are the common metaphors like overprotective alarm system. Your nervous system acts like a sophisticated alarm. This you can educate your patient. In chronic pain, it can become overprotective, signaling danger even when there is a no actual tissue threat or the small threat. So this way you can understand, give a better understanding to your patient. Second metaphor like distorted radio signal. Pain can like a radio signal with the static. Factors like stress, sleep, mood can interfere and making signal louder or unclear. So these are the small metaphor which easy to understand for your patient. Now the PNE has many important review where it has been shown that along with PNE, if you are incorporating the exercises, you will get better outcome. 100% only PNE is not the solution in chronic low back pain or chronic MSK patient, right? So you need to have some exercise model along with your PNE session. So PNE with the exercise which gives the better outcome results. Here are some studies where the PNE neuroscience education and motor imaginary based exercise protocol for patients with fibromyalgia, a randomized control trial. They have used a simple language, metaphors, interactive discussion, printed educational brochures were provided to the patient, and they have tried to shift their focus from pain belief, decrease fear, catastrophizing, improve pain-related knowledge, self-regulation, and emotional coping strategies. So they have found out good results on this thing. So the PNE helps to reduce the pain intensity. It decreases your disability, low fear avoidance, catastrophizing, improve movement for physical function, reduce or pain dependent medication. So PNE is backed by the evidence, right? It reduces the pain intensity, disability, fear avoidance. But of course, with the along with the exercises, proper protocol. So it is low cost, low risk, and high impact. It enhances your physical function and empower your patient power. But there are challenges for the PNE in applying, like some patient related challenges, like communication related challenges, some or institutional level barriers, clinician or the therapist centered barrier. So patient may resist new model, right? Patient always, you must have seen the patient want quick fixes. Everyone, no one want to listen a boring lecture, but you need to make educate the patient properly why it is important in your case. For that you need to find out the factors, right? So again, the communication is also important. Communication gap may confuse rather than giving clarity, right? System may not allocate the time for education, right? We'll see one by one. Like patient related challenges which include low health literacy education background, where the patient struggle to grasp the abstract of neuroscience education or concept. Misconception, misunderstanding about the pain being in the brain may be perceived in the patient as a dismissive. So cultural and belief barrier, these are another area where the patient has patient related challenges, where the patient may have believed pain is due to some karma, punishment, इसने ऐसा ही किया था, like this. A patient have some false belief or something like aging or structural damage is leading to this pain. So misalignment between the scientific model and traditional cultural pain belief. This is important barrier in patient-related challenges. Again, resistance to biopsychosocial approach. Many expect hands-on treatment. No one want to education. Okay, hands-on treatment, quick fixes, not educational session. You must have seen many reels or viral videos. The patient are loving that crack and knack sound, quick fixes, right? They don't want to listen a boring lecture. But why in your chronic pain patient important, you need to make an educated patient. For that you need to have the outcome. What are the factors you need to find out through the outcomes, right? The second, this is an interesting article where the pain neuroscience education through cultural lens, insights, challenges, and future implication. So again, in pain neuroscience education with different culture, has there are different beliefs in different cultures to target. This is another barrier towards the patient. Then second is a communication challenge where you are introducing neuroplastic pain, nociplastic pain. So these are the different terminologies and not easy to digest, right? True. If you are not making comfortable patient understanding about these terminologies, then it will create a complex for the patient understanding. Lack of cultural appropriate analogies, metaphors may limit the patient understanding and engagement. Of course, the time constraint, effective PNE often requires 30 to 60-minute lecture, which is not always feasible in busy outpatient setting, right? So you need to divide this. In weekly, you provide 3 sessions along with the exercises. So total 6 days exercises, only 3 sessions you will provide the educational session. So there are ways to find out the solution for these barriers. Then again, system or institutional barrier, where the lack of training in PNE. Many physiotherapists are not formally trained with delivering PNE or feel unconfidence where exploring the neuroscience. Right? Then biomedical domains in health system. The system often prioritizes structural or patho-anatomical diagnosis and intervention. They want X-ray, MRI, manual therapy, quick fixes, difficult to integrate biopsychosocial educational based content or care into the system, right? No integration into standard protocol. As such, there is no PNE is often not embedded into any clinical guidelines or prehab pathway. So this is another barrier. Now the clinician and therapist centered barrier. What about if I am not also believing on pain? I am not aware about the biopsychosocial model, or I am not comfortable with the biopsychosocial model. Their messaging may inconsistent. So this outcome, again, second is the outcome measure difficulty. Like many of therapists doesn't know about the which are the outcome are suitable for this patient. So we need to find out the outcome. And last is burnout and emotional fatigue. Explaining pain repeatedly, especially in the unresponsive patient, is very burnout and emotional fatigue for the therapist, right? So what are the clinical application of the PNE? Where you can help the pain to reconceptualize in pain patient, like help patient to understand about the pain is not always equal to tissue damage. It is especially in chronic condition. I'm talking. Reduce the threat perception by shifting focus from structural pathology to nervous system sensitization. And second, reduction of the maladaptive belief. PNE lowers the catastrophizing things, fear avoidance, kinesophobia by educating patients on in neurobiology of pain. So you need to change the belief of patient. Of course, it will take time, but you need to have proper protocol for that patient. It is individualized, patient tailored approach, right? You need to find out your patient how many sessions your patient is requiring for this type of session, and which session is patient wants. Then this improves the patient engagement, enhance the motivation, compliance with the active rehabilitation by reducing the fear of movement. Of course, the support behavioral changes, which also encourage graded activity and pacing by improving patient confidence, understanding of the pain regulation, especially in patient effective condition like fibromyalgia or non-specific low back pain, chronic pain patient. So last is improving outcome in central sensitization. The organization, those who are already working throughout the globe on pain, there are different organization and different level. They are promoting and spreading pain education in different platforms. This is one of the famous platform, the ISP. We recently have got the fund for the ISP through this platform in 2022-23. This is our expert team where the Dr. Rinkal Malani, professor and head of the Department of Physiotherapy Department, MGM School of Physiotherapy, Prashant Mukanwar sir, professor and principal of KLE Institute, then myself, Dr. Vaibhavi and Utkarsha. These are the two or more faculty from MGM School of Physiotherapy. Those who have done this, we have promoted the educational session to the physiotherapists to promote the more pain neuroscience education towards the patient for better outcome. So these are the references, and this is if anyone want to have further discussion on this, I am ready to open. You can mail me. See, this is a very challenging topic. It's still I am also learning. The chronic pain is not just about the tissue, it's about the person, their brain, their stories. Only thing we need to discuss for the patients, so which will give the better outcomes. Okay, thank you for giving me this opportunity. Any questions? Right.
Good afternoon, sir. I have one question that what are the emerging physiotherapy techniques which we can use for chronic pain?
In chronic pain patient, na? Right. Before knowing the technique, you should know about which factors is responsible for your patient. So for that, I have shown the model, right? In that model, you have found out like psychological factors are more important for your patient. So make psychological appointment to that patient, make a multidisciplinary approach, find out the cognitive behavior session along with the pain neuroscience education, and then you have plan with the patient along with the exercises. For the different techniques, there are different methods or instrument where you can use. You can make a charts, you can make a flashcards, you can make a graphics, you can make different models for the PNE to understand. Even you can make a models, 3D models to understand the patients, where the patient can visit, see the model and understand their own neurophysiology of the pain. Then they will have the better understanding and they will come to your exercise session where you can plan a better exercise for those patients. Right.
Thank you,
Any
sir.
other questions? Any other questions from you people? Can you ask any
Yes,
question?
yes, sir. Good morning, sir. I have one question.
Yes, yes.
How can we identify the patients with central sensitization who would be most benefited from the pain neuromuscular education?
Right. See, as I told you, there are some different outcomes. For central sensitization, there is a central sensitization inventory or lead assessment scale, where you can find out the subjective score of the patient in that particular area or domain. Lead assessment. So you can show that patient, and after exercises or treatment, you can find out the improvement in that patient. And again, I want to add on that previous questions. Like in today's scenario, where the AI and technology is more of advanced, where you have many platform where you can plan or design a patient educational session awareness models through the technology or with the help of AI. So this technique also you can use in your education session.
Okay, thank you, sir.
So, on that note, I'll just thank you, sir, on behalf of entire physio team. It was my privilege to extend our heartfelt gratitude to you, sir, for giving such a valuable time, and you just shared your valuable insights with us today. And once again, I will thank you for giving your presence, for making this talk truly memorable. We are looking forward for much more new sessions and opportunities that you will just give to our students and to our visitors. Thank you so much, sir. Thank you.
Sure. Thank you very much for
Thank you.
inviting me. Thank you.